People with HIV or hepatitis come from all walks of life.
Any religion, any sex, any sexuality.
The percentage would be incredibly high. You will know someone.
Could be your friend, a close family member, could be a teacher, someone who you share the boardroom with.
They could be anyone.
We're everyday people.
There's just no reason to discriminate.
No. We're no different. It's just sick.
With sickness you found me, but you didn't find my life.
One of the most common questions I get asked is, how did you get your Hep C? And to be honest with you, I don't actually know. I was an injector many, many years ago. I was a really good person. I was a very nice person. I've always been like that. And I was nice enough to share my needles with everybody else because you couldn't just go and get a new one. It was very, very difficult, in fact. So that's certainly one way I could have got it, absolutely. I also got a tattoo in King's Cross around that time as well, and all the tattoo places didn't follow strict rules at all. The inkwells were all shared. In 1987, I had a really bad car accident and I had to have a blood transfusion. So I certainly could have got it that way as well. So I don't really know. There could have been three ways. When I first found out, I felt contagious. Because I hadn't been given any information, I was worried about how I could pass it on. So that made my self-esteem go tearing down a lot quicker than it had been for a long time.
Between my brother, my sister and myself, we all had Hep C. We all did the same thing. I was out with a friend and she'd already used the needle and she did up the next one for me, but using the same needle. I didn't know about transmission at all. The only thing she said to me is, okay, I haven't got anything. Took her word for it. I always remember that night because that's where I can see transmission happened. It was the only time I'd ever shared. And I trusted. There was someone telling me I haven't got anything.
I picked it up through an unforgiving way that I'll never ever do again in my life. And I contracted it from the person I loved the most, my ex-girlfriend. I never shared a needle in my life, ever.
When I was diagnosed with Hep C, I didn't know what it was. When I was diagnosed, I thought I had a death sentence. I honestly thought, oh well, I've done this to myself because of my drug use. Oh well, I don't care anymore. And it wasn't until my body started to tell me, you're sick and you need to take care of your health, that I started to look at what the virus was about and how it was affecting my body.
You can have all the knowledge on HIV, which I did, especially identifying as a gay man and knowing that those risks were quite apparent in our community. My lack of judgment in that case was trusting someone. The scenario was basically we were casual partners. On this occasion we'd actually bumped into each other out of the club and we went back to my place and there was no condoms, and my thought track was, okay, well, I know the guy, I trust the guy. If there's something I needed to know, I'd know it, and if I didn't know it by now, he'd tell me before we had unsafe sex, and that was a real mistake on my part, I think. When I got the equivocal result, I fell to the floor in the surgery.
3 years ago, I started to feel really ill. Indigenous Health were doing constant tests on me and they just didn't know what it was, and I had to go back to my family and say, well, what were some of the things in our family and were there any health issues that I need to know about? And it was an auntie that told me that out of 13 siblings, every one of them had hepatitis B, and us older children, there was a good possibility that we would have hepatitis B because we'd missed out on that immunisation process. So I think I was in the police service at the time doing foot patrols, and the doctor phoned me from Indigenous Health and said, I need you to come back in. So I went in to see her the next day, and yeah, she just said she's sorry and that yeah, I had hepatitis B. I have chronic hepatitis B. and that was passed to me from my mother. And there would have been that possibility of actually curing it and not living with it. But unfortunately for me, when I was a child, I missed the immunisation stage. So I said, does it mean I'm going to die? And she's like, nah, you're not going to die. Yeah. That was emotional for me because I always thought I'd live a healthy life. Yeah. So now I've got to be wise about what I do because I want to be around longer for my stepchildren, for my partner, so now it's just about managing it. And it makes you feel ashamed and limited. Limited to what you can do in the community and who you can do it with, because not everybody's embracing and has open arms when it comes to interacting with somebody that has hepatitis A, B or C. They form their own opinions. And I don't know whether in between managing my hepatitis B and managing my lifestyle, I don't know if I have the courage to fight on against someone that wants to discriminate or put me down because I have hepatitis B. I've got enough to worry about, let alone fighting that. I've got to fight for the right things. I've got to fight for my health. I've got to fight for a longer life with my children. They're the things I've got to fight for.
Discrimination is still rife.
As soon as they hear someone's got hepatitis, it's like, ooh. And it's like related to a real dirty word. You know, it's like, ooh, hepatitis.
As soon as they see that word hepatitis, that's it. It's like the eyebrows are down, they're frowning. You know, people are too scared to take a case.
I had an operation and I had complications after it, and I got an infection, and so I said to Debbie, I'm really sick, we need to go up to emergency just to see if I'm okay, you know, because I was in a lot of pain as well.
And we're sitting there, there's only like 2 other people in the waiting room, and a pregnant doctor came in and grabbed Nikki's file. And I was looking at her because I'm thinking, oh great, we're going to get called up. And she went, oh, hepatitis. And threw Nikki's folder down and put her at the back of the thing and said, I'm not touching that.
And when Deb heard that, it upset her very much to a point where that was it. She got up and said to the nurse at the emergency, we've been here for so many hours, we need to see a doctor now.
We'd spent, you know, a good 8 hours there. They took us into a cubicle.
And my file was there. And Debbie said, oh look, what they've written on your file, Hep C positive. I said, but I'm not.
And she'd actually stated to the doctor that she'd been cleared, and they just obviously didn't even listen to that and just put it down on her chart.
And then Debbie pointed out, oh, there's a sticker on your file that says alert. I went, what? And I got really upset. I said, what do they mean? Alert, alert. Because I was thinking, alert, Hep C. Yeah, and Debbie was playing games with me. She said, no, don't, Nikki, it's only that you're alert.
We sat there for like 3 to 4 hours before even a doctor would come in and see her.
We did realise that they weren't coming in. They kept walking past the doctors. Deb was getting upset, I was getting upset, and I just got to a point where I said, I'm going. I'm not waiting around here anymore. And we just left.
Unbelievable how she was treated, like she had the plague.
Makes her feel terrible, like, you know, like she's an alien. It does, and like she feels like she's alienated because of the disease.
Of course you're going to get paranoid because you're going to think, oh, how are they going to treat me? You know, they shouldn't be treating me any different to anyone else.
Why do people get discriminated against? I think there's a couple of reasons.
Stigma exists purely because of a lack of education.
There's a fear of acquiring the infection, and so people are concerned about their own well-being.
And I think there's still that perception that things like touching a person that has HIV, am I going to get it? Is there a risk that I'm going to catch it from treating this patient?
It's just like, oh my God, do people really still think like this? Is if anyone's got to be worried, it's you as a patient. Are you practicing safe protocol?
If you're going to work in an environment like that, you should be up to date with current practice. and the risks associated with that practice.
It really doesn't matter, what the underlying medical condition is. We should treat everyone as if they've potentially got a bloodborne virus. And so that means if you're working with blood or with body fluids, then you should be wearing your personal protective equipment. You should have some gloves on, plastic gown, and if you think there's a risk of a splash injury, you should have some goggles on for your eyes and perhaps a mask. But if you're just mopping things up, then you would be wearing your gloves and your gown, cleaning things up, disposing of your personal protective equipment when you've completed that activity.
And calling on and being a part of specialised groups that deal with, say, hepatitis or HIV reduces your anxiety.
The discrimination that I have been affected by with the hepatitis C comes a lot from the discrimination for me being an injector as well.
He goes through a lot of having to explain himself a lot to people, which takes a toll on him, sort of like having to explain not only this disease, but then deal with people's reactions as well.
And why did I inject? Retrospectively, I injected because I didn't like myself. I didn't like who I was. I didn't like that I talked too much. I didn't like that I was average. I didn't want to be that insipid little nothing that I felt like I was, that had wanted to be physically abused as well as emotionally abused, pretty much all my life. And this drug made me 10 foot tall. Why wouldn't I have it? Why wouldn't I stay on it? Then all of a sudden, I couldn't stop.
Oh, the only thing to worry about with living with someone with hepatitis C is the effect that the rest of the world can have on them.
I'm sure we've all done something in the past that we like to regret. However, some of us are luckier than others not to have any side effects of it.
I feel like I'm left out. I really do, because of the way I contracted it. Are you still taking drugs? They're still asking me that to this day now.
Absolutely, they have a focus on how you got it. How did you contract Hep A, B or C? Of course people do. And that's all they're worried about.
The assumption of how you get HIV is something that frustrates, I think, everybody that has HIV. The focus is taken away from how you cope, how you live your life, how you should be treated, and there's so much emphasis on, oh, well, you're a very naughty boy, what did you do to get that? Was it drugs? Was it sex?
If I'd go into the specialist would say things to me like, so you sure you got it off your mother? I said, yeah, I'm sure I got it off my mum. And she said, how do you know that? So it's not from sexual intercourse or needle use? And I'm like, no, I've never used needles in my life. And I know that it's not from sexual intercourse. She goes, oh, righto then. So have any of your brothers and sisters got it? And I said, yeah, they have, the older ones. And she goes, and what are they doing about it? So I'd walk out crying and I'd get really upset because I was frightened I was going to die if I didn't do what she said, and I was just getting all flustered. So there was nothing fruitful coming out of my interaction with that specialist. And there was no consideration cultural-wise how they should work with me, talk with me, understand me.
I've had issues with getting medication from the pharmacy there at the hospital. The looks and the stares and the pointing, and the script got passed around through all the different pharmacists that were there, and they were looking over at the counter and looking to see who was coming in to get this medication. So I wasn't very happy. It's like, I guess I was worried that they were judging me, like, how did you get it?
I shouldn't be fearful of going to a doctor. I shouldn't feel ashamed of having HIV. It's something that I have to deal with every day of my life.
If you're talking to a doctor and the doctor is being really judgmental about who you are or assuming where your background is, the likelihood of me going back to that doctor is pretty small.
You see a lot of people who come from unprivileged backgrounds who may have not completed school or had the appropriate education or the upbringing or the role models that most people are lucky to have. And basically, My way of thinking is you should look at where the person has come from.
Don't take my past as my future, because in my mind I've changed. I've been there, done that now. It's all finished, it's all gone. I just don't want to be treated like a person who's a drug addict or alcoholic or, you know, somebody off the bloody street. I never was.
I can look back at it and think, wow, I've come a long way.
She's had a lot of grief in her life.
Yeah, I lost my mum when I was 13. I was just hitting high school, so that was a big change in my life because all of a sudden Mum wasn't around and all of a sudden we were flung back to Dad. Dad was a chronic alcoholic. And then I ended up on the streets in Woodridge because Dad kept moving us around because he was a chef.
I was frightened for her, really, to tell you the truth.
So I was looking at 3 options: death, homelessness or jail.
She just didn't have that guidance, so... And, you know, seeing her mother the way she was, because Mum overdosed, so it was just a traumatic thing for her and it just affected her whole upbringing, so... And then, you know, going from pillar to post to different families and no stability. So that just led her to that path.
Now I'm pretty much being respected as an artist, you know, a professional artist. And I've got a bachelor degree. How the hell did I do that from being a full-on drug addict? I got a bachelor degree. I mean, I'm really proud of that. No, I don't use anymore. I often get asked, are you still a user? No. I've cleared Hep C. And to me, that's a really positive story to tell a doctor.
It's really not about how it was contracted, but it's about the fact that you've got it now. And now, what do we do about it?
The good doctors are out there having conversations with their patients. They're listening to their patients.
Yeah, I moved on to a new specialist, and immediately when I walked in, he asked me about my family, about my job, about my partner, about things I've done in life, what I'd like to do in life. So he immediately attempted to establish a relationship, which made me comfortable straight away.
I'm afraid it's a bit of a no-brainer for me. I think you need to have a good relationship with your patients, both for them and for you. You need to know a bit about people so you can make good decisions about what's appropriate care for them. It's not enough just to treat the disease. You've actually got to understand a bit about, you know, where they're coming from, because there may be other things going on in their life.
The healthcare centre that we're at today is a great example of showing how a health professional can produce positive health outcomes for their clients because of the way they communicate, the way they build rapport with the clients, and they generally just understand the clients and their backgrounds.
One thing that I like to say to people is HIV, it's 3 letters, and that's how everyone thinks of it. But if we step back for a second and remember that the first word is actually human, and we have human rights.
The thing that I keep coming back to is that as healthcare professionals, we're looking after people with an issue, and we put our hands up to do that. You know, I'm a healthcare professional, I'm going to try and help you with your problems when you come to me if I can. And so then to decide you're going to discriminate against someone for that healthcare problem, I just can't keep that together in my head. It just doesn't. It seems very contradictory sort of approach.
We're not untouchable. We are touchable. We're human beings that have families, that have needs and wants, and a lot to give. So that doesn't make us any different to anybody else. We just happen to have this virus. That's all.
This journey is for real. The tears, they aren't for long. It's about smiling and enjoying life, the courage to go on. For every season there's a reason to go against the odds. The future with my family gives me the hope to keep things strong. Sickness, you found me, but you're no friend of mine. Living stronger, smarter, more healthy. It's the reason I'll survive. With sickness, you